Ear infections are usually split up into what we term as outer ear infections or inner ear infections, so that's behind the eardrum. Patients usually present with having pain in their ear, having itchiness, having a discharge possibly. So that's something that we see very commonly. In the other patient group, you will have patients who've had an upper respiratory tract infection due to a cold, and they feel that their hearing is down and they can't quite equalise the pressure in their ears. They might have pain, they might have discharge coming, and that's usually due to a build-up of fluid in the middle ear. The treatment for both is actually antibiotics. The clinical diagnosis is made by doing an examination of the ear with either an otoscope or a microscope. You might see some skin debris or some pus in the canal. The treatment for that would be to perform a swab of the ear, to perform microsuction to remove that debris and treat the patient with drops for their ear or topical antibiotics. If on the other hand you think it's a middle ear infection and it's associated with a cold, then the patient would be given a course of oral antibiotic therapy. Patients will commonly come with blockage of their ears, and the commonest thing is that they have wax impacted in their ear canal. So we can actually perform microsuction. Once the patient's actually positioned into a chair, they're positioned under the microscope, so we have a magnified view of their ear canal, and we can use a small hoover to remove any wax from their ear.